Okay. So what I want to tell you first is what we did yesterday was the application of 4 rules. The first one is PP, RRR, AA, DD, DD, WK. After
Excuse me,
that,
sir.
yeah,
Sir, your screen is not showing to me, sir.
if it is not so, if it is so, then you have to leave the class and come
Oh,
back. I will add you back.
okay, sir. Thank you.
Okay, if anybody experiences such issues, please leave the class immediately and then come back. Okay, and then secondly, there is another problem is sometimes I have some network issues. Okay, so in case of any kind of network issue, those issues will be solved within 5 minutes. If it doesn't solve, then we will have to postpone the class. I will provide the same class at some other time of the day. Okay, so please bear with me for that. Now, yesterday we were discussing the same thing. Paradox. After paradox, we discussed DATS. After DATS, we have a PRPDD method. After PRPDD method, we have a diving and rising. These are the 4 ways to write your letters perfectly. Please be silent in the class. When you turn the page, we can hear. Please completely be careful in the class, everybody. Okay. So we have very few, very simple methods, and you may be asking, no, this is not the way I want to learn OET. See, please don't say this way. Please don't say, please don't decide the way you want to study. Okay, in my childhood, I was like this. I was very much like this. I used to tell all my teachers, no, this is not the way I want to study. No. So it is totally stupid. Okay, maybe somebody may have taught you in a different way. So you don't expect me to teach in that way because our methods are the easiest. That's it. No complications. Very simple. Okay. Now we have just 4 methods. If you understood paradox, how many of you can raise your hand if you have understood what is paradox? I mean, at least 80% of paradox you have understood. Please raise your hand. Those who understood paradox, 80%, please raise your hand. Good. Okay, please put your hands down. And how many of you understood DADS? DADS, date, address, dear sir, dear doctor, dear nurse, and finally subject, that is usually RE. You know that. So DADS, how many of you understood DADS, please? How many of you understood DADS? Okay, moms are very important in our life, but on the day of the examination, dads are very important. Don't forget dads on that day. Okay, then the next one is PRPDD. Very easy one. We have got 5 different PRPDD. One most important one is simple PRPDD. Another one is UPRPDD. Another one is TPRPDD. T stands for thank you for accepting. T for thank you. And then we have got RPRPDD. This is regarding the care of Mr. So and so. That is RPRPDD. And sometimes we have only PRPD. Yes, in which case, anybody knows? When there is no discharge date mentioned. For example, if a patient comes to the clinic, of course, there is no admission. You don't admit a patient in the clinic usually. Or you go to a patient's home for daily home care. Of course, there is no admission. In a palliative care, there is no admission. That's a long-term admission, fine. In a rehabilitation, in an old age home, no admissions. So the patient does not come to the hospital. Actually, the patient is there in the hospital, in the old age home. So when there is no admission, there is no discharge. Remember, PRPD, we will discuss in detail. PRPD is only for cases when there is no admissions. So how can we say that the last sentence, she is being discharged today? No, we cannot say, right? So that's the reason. So there are 5 PRPDDs. Which are they? UPRPDD. Simply the most common one, PRPDD. TPRPDD. Thank you. Okay. And then last one, RPRPDD. Very common. We can write. So these are the BRPTTs. And then finally, we have got the most beautiful diving and rising. Of course, we will be learning diving and rising next week because we need more courage to dive. Okay, before diving into the water, we need more courage. So once these things are very clear to all of you, we will start with the diving and rising next week. Okay, so let's start with another very important one. While discussing this yesterday, I told you something. RRR. The third R. What is that? The first R is recipient. Second R is request. And the third R is what we are going to do today. Relevance. Okay, relevance. It's a very interesting class today. Please do not leave this class in between. Okay, because I'm not teaching the way you want me to teach. Okay, so I'm teaching the way you will pass OET. That's the way. Okay, now listen. We are going to remove all the unnecessary waste materials from these case notes. Do you know one thing? OET is very, very, very intelligent people. They will include at least 20% waste in every case notes. Okay, and they will include at least 20%. These percentages are simply, relative. It can be up or down. 20% grammatical errors they include. Somebody is cooking in the class. Please, will you please cook later on? Wow. Please give me one coffee tea. Who is that? Who is that? So insensible, please. How can you think about going abroad with this attitude, please? I'm sorry to say this one publicly, but please be careful in the class. Even I too want to drink some water, but I don't drink water during my class. Be careful, be careful. You have to be, whatever and whoever you are. I don't know. Fine. Next one, 20% of the case notes will be having another issue. They will, you may have noticed, they will include words like patient. She is a patient. And if you write the same word patient in the letter, you are sure to lose that OET examination because we are not allowed to use patient. Okay, she is a patient of, and you can also write word like a case. No way, no case. You cannot write obese. Okay, you cannot write so. You cannot write furthermore. You cannot write. If you write these words, you are definitely going to lose. You cannot write the word hence. You cannot write the word besides. You cannot write the word drunkard. In case I commit any mistakes during the class, please remind me. Sometimes I also commit these mistakes. Okay, you cannot write the word drunkard. You cannot write the word smoker. Who are you to judge a person? Okay, so suffering. She is suffering from obesity. Just for those two words, you will be losing the entire OET examination. She is suffering from. How do you know that she is suffering? How can we say that she is suffering from obesity? Maybe she is very proud of being very obese. Maybe mentally she is having some issue. So when she becomes very stout, very huge in size, she may be very proud of that. So how can you say that she is suffering from that? Okay, so that could be the reason we are not supposed to be judgmental in our language. Okay, I'm not talking about the judgmental thing here. Today we are going to understand how to remove these waste materials. Okay, so this is what. Can you please look at the bottom of this page and find out something like this one? What is the purpose of this letter? A home visit, right? To give instructions, self-monitoring of blood glucose levels and insulin injections. This is a purpose. And then now you have to tell me which of these points are important and which of these points are not important. A home visit and instructions, self-monitoring. So, of course, definitely we know that Miss Anita Ramamurthy is important. She is 59 years old, is important. Is a patient in the inpatient department of the hospital in which you are charge nurse. Charge nurse is also important, but inpatient department is not at all important, I think. Now, usually every time I leave this task to you, because I am not a nurse. Okay, therefore I need your help in this case For the relevance classes, for all the relevance classes, the freedom is yours. Now you can tell me which of the points are to be included and which of the points are not to be included here. All the time, please look at this one. Please look at this one. We are looking at this point. A home visit, instructions, self-monitoring of blood glucose levels, insulin. And who is a recipient? Who is a recipient?
Miss Prabha.
Yeah, okay, that name is okay. But then what is she? What is she? Miss Prabha is okay. Home care agency, okay, and requesting a home visit. Home visit is the main thing. Okay, so you have to tell me which of the points are important and which of the points are not important. 1 second, please. Who is making that noise, please? Please be careful in the class. This is the reason why the class will become very dull. You have to be silent and okay, now I'm asking one by one, we are going to remove all the irrelevant details. Irrelevant means unimportant details. Details which are not important for the recipient. Fine. So we can say that Mrs. Anita Ramamurthy is important here. Just tell me which of the information are not important. Is woman important here?
No, sir.
Because
No, sir.
Mrs. means, okay, is a patient in the inpatient department of a hospital in which you are a charge nurse. Almost this much is totally unnecessary because we are writing for a home visit and that is it. Hospital, Sydney Women's Hospital is important because we have to mention that somewhere in the letter. It is not very important, but hospital is also not important. Where will you write this hospital name? Will you be writing the hospital name anywhere in this letter?
The last.
Last week you can write, okay, you can write Sydney Women's Hospital, you can write, okay, let's include that one, but still that is not very important. So I am considering this as a semi-relevant information. Semi-relevant because you only have to write, close the letter this way. I can show you how the letter will be over. See, yours sincerely, charge nurse, full stop. Now, why do you want this Sydney? Okay, suppose you want this way. 1 second. The space is important here, please. Remember, there is a space between these two. Okay, earlier we used to write without space, but now we need one space in between. And here there is a full stop. If you don't want a full stop here, you can write Sydney dash 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 hospital. Okay, so you can write, but that's not really required here because whenever you write a letter to somebody, on the letter pad you write. On the letter pad you write. So on the top of the letter pad, the phone number, address, and everything of the center's address will be there. So why do we need to write that hospital's name? So I consider that aspect, this one, as a semi-relevant information. So her marital status. Do you think her marital status is important for the recipient?
No, sir.
No,
sir.
No way. Okay. So before you say yes or no, you have to also think. Only one thing you have to think. If I mention her marital status, is this going to be useful for the recipient? See, I repeat. Is that information going to be beneficial for the recipient to provide the given requests? So if she is married or not married, why should I care about that? Her height and weight, are they going to be important?
No.
No, sir.
Yes, sir.
So,
Yeah.
no, in what sense? Like height and weight totally unimportant. Why is BMI important? Somebody said it is important. If you want, you can answer that. Otherwise, I can answer that. Will that be important for the recipient? BMI? BMI is also not important because the recipient is not going to provide any treatment for that. Just that. Okay, she has to only go to her home only once and give instructions about the self-monitoring of blood glucose levels. This is a very good case note for everybody to learn how tricky OET can be. Fine, then we need this one. Address for correspondence is required. Why? Because the recipient has to go to the place of the patient, right? Okay. Otherwise, how will she locate the person's place? Because it is a not known case, right? So definitely, suppose if Alfonso Matthew, one of us, if she is the recipient of this letter, that means she is going to visit this patient, Alfonso Matthew. Okay, so Alfonso definitely requires to know where she lives. So therefore, this is important. And do you think this admitted and discharged, these things are important?
Yes.
It is needed.
In fact, it is not really very important, but without this, we cannot write a letter because the second paragraph of the letter will be always starting with the admission time. Okay, so admission is important here. Date of discharge is also important. Otherwise, how will you write the first paragraph? Because in the first paragraph, PRPDD, the second D, discharge date, and she is being discharged today. See, and she is being discharged today. So this is also important. Diagnosis, acute appendicitis with of course, it is a very important one because she is going to have a surgery also. This is also important in a way. But see, remember one thing, we are writing to whom? Okay, and what is the real purpose? It's all about insulin and blood glucose level monitoring. And why should we tell her that she is having acute appendicitis with the appendicular lump? Is it important? Tell me, is it important or not? Because
It is important for surgery to regulate patient's sugar.
come on. Yeah, tell me once again. It is important.
It is important for patients going for surgery, sir. For that, we have to regulate the patient's sugar.
Okay. So that is the reason we have included, because it's a kind of a very important information. Now, treatment, conservative management with IV antibiotics. Should we tell this to Alfonso Matthew? Should we tell this to the nurse who is going to meet her at her home? Should Alfonso Matthew know about these things?
No, sir.
No.
Because Alfonso Matthew is not going to involve with the treatment, right? But please think differently and tell me. If anybody thinks it is important, please tell me. In some way, if you think it is important, you can say. The recipient, is the recipient going to worry about the treatment that is going on with at present? Or will insulin injection and other things will have any kind of impact on the IV management, IV antibiotics?
No.
No way. So we can eliminate that. Good. Please be careful. If your kids are there, please ask them to be silent, because there are 80 people. All of them are very busy people, so nobody has so much time. So nobody wants to be disturbed. Okay. Planned for interval appendectomy in 6 weeks. Is this important?
Yes.
Is this important?
Yes, sir.
Yes, sir.
Yes, sir.
Because that is a very important day in her life. So, okay, now we are coming to the social background. Every time OET writes social background just after the patient detail. You know what is the reason? Did anybody think about the reason for this? This is another trap. Okay, a very big trap. You will think, okay, in the case notes, social background is having such great relevance. That's why they have put that in the beginning side, in the beginning part. So everything is going to be important in this case. That's what we think. This is a trap. Why is OET trapping you? Do you know why OET is very cunning and very tricky with you? OET wants to get the best nurses and doctors out of you, people who have common sense. Okay, so that could be the reason why they are providing. So be careful. We have to overcome this issue also. Do you think Elizabeth, Alfonso Matthew, who is going to visit her, should she know that she is a businesswoman who is having education consultant something?
No, sir.
No, sir.
Okay, we can remove the education consultant, can be avoided here. Then, okay, I'm just removing this education consultant. No business. She has no business in this case. But is it not good to say a little bit about her social background? She is a businesswoman. Is it? Do you think? Will this help Elizabeth Matthew? That's what I am asking. Instructions on self-monitoring of blood glucose levels, insulin. So will Elizabeth Matthew say, madam, you have to change your business. You have to change from education consultant to do something else so that your insulin means your blood glucose levels will be all right. Will she have to say? Do you want to include or not?
No.
No, sir.
No.
Okay. I will take this into this one, semi-relevant one, because a single word may be important to give some introduction about her social background. Otherwise, we will not be having much to. Coming to this one, she's having hectic life, travels a lot due to work. Is this connected to her present condition?
Yes, sir.
Traveling?
No.
No, sir.
Hectic life.
No.
Okay. Hectic life.
Yes, sir, because
We can
Heck.
include
A stressful life
sir,
we
we
can
should
include.
include because
she is busy, no?
Okay.
So self-monitoring and insulin administration is sometimes
Not possible.
will be difficult
Okay.
because she is a busy businesswoman.
Okay. Okay, in that case, this businesswoman will be important. You're right. I'm adding this as a relevant information. See, today's class will be the only relevant class. Relevance-based class is today. So this class will help you to remove all the waste materials from a case notes. So only for one day, that is the second day of every month, we will be having the relevance class. So it may continue to the 3 p.m. class also. So everybody, you have to join the class to completely understand this one, because many people, if you include any irrelevant information in a letter, that is the end. You will not score anything, any score for your writing in the examination. Hectic life, travels a lot due to work, can be included. I think should be included because we are always talking about instructions, self-monitoring, and insulin and other things. Okay, lives with husband, Mr. Krishnan Ramamurthy, lives with husband. Do you think husband is having any importance in this case?
No.
Why can't you think the other way, that if she lives with a husband, Mr. Krishnan Ramamurthy can also do something to help her with the self-monitoring? Is it important?
Important.
Come on, why? Two married daughters. Elder daughter stays in Sydney, about 3 hours away, works as an entrepreneur. Younger daughter in Canada works as a dentist. Are they important?
no,
No. No.
No.
not important, sir.
Like she is not an old age woman. What is her age now? What is her age? 59.
59.
So the daughters may not be, especially the one who is in Canada, she's not going to come for self-monitoring, of course. We don't need this one. We can also avoid this also. Totally wasted. Okay. And again, I have not decided about this one. Lives with the husband. So we can include, husband can be included here. A little bit of, okay, because we cannot completely remove everything. But his name is not important. Do you think his name is to be important here?
No,
No.
not important.
Okay, and she has 2 married daughters. Also, they are not going to be important in her care. So we can remove that. Husband is the primary caregiver. Elder daughter visits with the husband once a year. Husband is a primary caregiver is to be included, whereas elder daughter is not going to have any relevance in this case. Now, another one. Scared of hospitalization, prone to anxiety related to this. What do you think about this one? Scared of hospitalization, prone to anxiety related to this.
Important.
Not related.
Remember, you may
Not.
say it is important because she is going to have an appendectomy, right? She is going to have an appendectomy in 6 weeks, right?
Yes, sir.
But my
Yes, sir.
question is, why should Alfonso Matthew worry about that? Is it her duty to give her guidance about hospitalization and the fear about that?
No, sir. Her duty
No,
is
no,
also
no.
to.
No, no.
Yeah, remember. This is very important point. This is the reason why many of you lose. Okay, I was fully prepared for the OET writing. My trainers used to give me 350, 370, 3 or 400. But I don't know what happened. OET is always cheating people. They are money minded. They are this and that. Okay, I also used to say the same thing. But now I think that it is our own limitation. We have to do our work. Only then we can blame OET. Let's do this way. So scared of hospitalization is none of Alfonso's business here. Because in the plan, see now, in the plan area, oh, who is that? He is something like some rats are moving in the class. I can hear the sound. Doesn't it disturb you, please, all of you?
It does, sir.
It does, it does. Please be careful, everybody. Okay. Okay, so now to be more careful about this one, how to know whether this is, go to the plan area, please. Go to the discharge plan area. In the discharge plan area, which of them are relevant for or Alfonso Matthew? Avoid strenuous activities and travel. Advice to lose weight, exercise program to start after appendectomy. Normal diabetic diet and low fat diet. Patient request more information, especially simple recipes that can be easily prepared at home. May I ask you one question? Is Alfonso Matthew going to give her instruction on this one? Is her duty about that? Instructions about self-monitoring of blood glucose levels and insulin. Is she supposed to give her advice about this?
No, sir. No, sir.
Okay, what about this one? Monitoring of fasting and postprandial blood sugars. What about this one?
Sir, but in the
Yes.
request they are mentioning that she should give advice about the diet. So,
Okay, yeah, that's the reason we have included this one. Okay, diet. Where is it in the request area? In which area, please?
in the discharge plan itself, sir, normal diabetic diet and
Normal
regarding
diabetic
disease.
diet.
Okay. Love that. Patient requests more information. Okay. Yeah, of course, you're right. This one is to be included. Right, you're right. Because it is connected to the same thing. Okay, now.
Sir, if it is connected, means that is the that instruction should be given by the dietitian, no, sir.
But you know, that is to be given by the dietitian, but of course,
Her duty is to only instruct the self-monitoring of blood glucose levels and regarding insulin.
But then you can monitor your blood glucose level even by means of your dieting also, right?
Oh, okay.
But it's not mentioned.
Mentioned, and if it is mentioned, means that BMI is most important.
BMI is most important in that case, right?
Yes.
Patient is obese also.
Patient is obese also.
Okay, so that can also be included, right? The initial part. Okay, fine. Anyway, okay, so let's go back to the starting point. And here, where is her obesity? So weight and this one. So you think it is to be included, right?
Only BMI is included.
Only BMI. Okay, only one of them is important. Okay.
Yes.
Okay, so that means it is important. Right. Going to the next page. Okay, here. Now, my next question is. Yeah.
Excuse me, sir. Sir, also regarding the travel a lot on the second page.
Okay, traveling a lot.
And in the discharge plan, yes, sir. Because in the discharge plan, they are saying that she should not do hectic activities and traveling.
Yeah, that's why we have included this one. This is green. No, green indicates it is important, and red indicates it is not at all important. Okay, and this color indicates it is semi-relevant. And you know why semi-relevant thing? If you find so many semi-relevant information in a case notes, you know, will you add or will you remove? If there are so much of semi-relevant information, what will you do? What will you do with the semi-relevant information?
Remove.
You will remove or you will add. There are two things. You will remove, suppose the letter, you know what is the word count of a letter? 200 is the best word count. 200.
180.
Yeah, it can be 180.
Did to 200.
Yeah, 182, sorry, 182, 200 to how much? 220 maximum. You can go up to this, no problem, okay? Because officially OET has said that word count is not at all important. Is there anybody here in this class who keeps on wasting time by counting the word after every line? No, please don't.
No, sir.
Please don't do that, okay? It's simply a wastage of time. So you don't have to worry about the word limit. Sometimes it may be 180, sometimes it can go up to 220, but do not include any irrelevant information in that case. So now suppose you think that only 180 words are going to be there or 160 words are going to be there in this letter. Okay. In that case, you can do this one. You can include most of the semi-relevant information. Okay. But you think that it is going to be 240 something. In that case, what you can do is you can remove almost all the semi-relevant information. Yes, this is a beauty of semi-relevance and relevance. Are you getting my point?
Yes, sir.
Yes, sir.
Now let's go to the next one. Scared of hospitalization, prone to anxiety related to this. So do you want to include this or not? She means Alfonso Matthews' duty is to go there only one day, give her instructions on self-monitoring of blood glucose levels and insulin. So is it her duty to tell her about hospitalization phobia?
No, sir.
No, no.
So we are removing that. We are removing that. Anybody, if anybody thinks that this is relevant, you can tell me. Fond of eating out, rarely cooks at home, sedentary lifestyle, complaints of no time to exercise due to work, does not drink or smoke.
Needed, sir.
Relevant.
Sedentary lifestyle is needed. sir.
Very
You can-
important. Sedentary lifestyle. I think this word, sedentary lifestyle, how many of you know the meaning of sedentary lifestyle? I mean, you know the meaning of sedentary, what is the meaning? What is the exact meaning of sedentary lifestyle? This is a very, very common word that you can see in the...
a luxurious life.
Is it luxurious? Any other meaning? Sedentary?
No, not an
doing
active
active-
life.
Not doing any
Not
activities
active.
or exercises.
Yeah.
Active.
Active
Yeah.
life.
Yeah, like she's not very, always sitting somewhere. Okay. Like a disorganized life, you can, sedentary does not mean that way. Please try to understand. A disorganized, inactive life is called sedentary lifestyle. Always sitting, just like these days I'm leading a sedentary lifestyle because most of the time I'm in front of the computer giving classes. Okay, so right, going to the next one, diet. This is her diet: whole milk, ice cream, shakes, fruit drinks, donuts, pancakes, waffles, pizzas, all these things. Okay, do you want to include or not include? Is Elizabeth Matthew going to be worried about this or not? Instructions on self-monitoring of blood glucose levels.
No, sir. Already we included sedentary lifestyle.
It is already there. Okay, so that will be an unnecessary repetition. Okay, sedentary lifestyle and those information is fine. And also, this is not good for a nurse who is just going for instructions on self-monitoring. It is okay for a dietitian, right? It is good for a dietitian. Anybody, please tell me. Anybody thinks that this has to be included? Anybody thinks?
No, sir. Not relevant.
No need to, sir.
This is
The
totally
nurse is not a dietitian.
Already in discharge plan, it is there. Diabetic
Okay.
diet.
In the discharge plan. Let's go to the discharge plan. Where is it?
Normal diabetic diet and low fat diet. Already she is going to instruct that. So no need to include all these items.
Okay, okay, fine. You're right. Okay, so we are removing this also. Okay, we are removing this. If anybody wants to include this, please tell me the reason also so that we can. Then, what is her medical background? Now, how many of these things are to be included or not included from the medical background? Let's go on to this one. known case of essential hypertension and diabetes mellitus type 2 not compliant with the diabetic medication. Tell me, do you want to include this or not?
Yes, sir.
Yes.
Relevant
Should be added.
Of course, yeah, diabetes mellitus is already there. Known case of, so it is
History that is no.
fine, but then what about hypertension? Is hypertension relevant in this case?
It's relevant.
Semi-relevant.
Semi-relevant.
Hypertension also.
Is there any connection? Is there any connection between hypertension and diabetes?
No.
Yes, yes, in a
Sometimes.
way.
Yes, it is there, sir.
They coexist most times.
They coexist, right? Okay, but because of the coexistence of hypertension, do you think that the patient of diabetes is going to have more risk because of the coexistence of hypertension?
No, sir.
Hypertension.
Yeah, tell me, come on, because
Risk.
hypertension is a risk
factor.
Okay, hypertension is a risk factor. Okay, and she's having hypertension from 2019. And the other one is 2015. Okay, that is older than
Recently diagnosed.
Okay, recently diagnosed does not mean that she did not have diabetes mellitus earlier. Probably she had it maybe 5 years ago, but it was pre-diabetic time. Okay, and so when she was diagnosed is not a very important thing here, because some people go undiagnosed for a long time, right? Now, so which one is more important here and less important? Are we going to give less importance for this one? Is hypertension? Yeah, less importance for hypertension and give more importance for the other.
Diabetes.
Yes.
Diabetes mellitus.
See, as I told you, this is the only class this month we will be discussing, relevance. Because this is a class in which I feel most discomfort, because I have a limitation in understanding some of the medical terms here. Okay, so admission and diagnosis. Of course, we are going to another important area. Complaints of pain in abdomen. So, do you think this is important or not?
No.
Yes.
Most important.
Right.
Yes, sir.
It is important, because otherwise, how can you write the second paragraph? The second paragraph always starts with this one. Miss Dash was admitted to the facility on this date with the complaints of this and this and this. So without that, there is no second paragraph starting. So anybody, any other opinion? You can oppose me. I want every student to argue with me. I'm always open to that, because if you don't argue with me, you won't study. You will be simply sitting in a corner. Everybody come forward and argue with me. I won't feel any
It is
hurt.
needed, sir. It is needed.
Yes, it is needed, right?
Yes.
Pain was sudden in onset, acute in nature, and was non-radiating fever. Oh, do you think this is important?
Onset and acute in nature needed.
But see, Alfonso Matthew is going for giving instructions. And why should she know all these things about the pain? She's not.
need.
Can you scroll up, sir?
Yeah. See, the first sentence is important, because without that we cannot start the second paragraph. But then, since see, there are two problems here. One is insulin related things, one is diabetes related things, one is her abdomen and her appendicitis, right? And Alfonso Matthew, that means the recipient of this letter, okay, she is not worried about that. It is none of her business in this case. So do you think anybody, any experienced people in this class, please tell me, because I'm not the right person to give the final answer. Is there anybody here who knows, who can say that this is to be included?
So when she's mentioning that pain in the abdomen, maybe she will ask how is the onset and the nature also, whether it is persisting or whether it's onset. I felt like that, sir.
Megha, okay, fine. Your observation is good. Megha, one problem is there.
Yes, sir.
But already she is scheduled for the surgery.
Yes, that is it.
After 6 weeks, that is.
Yeah, okay. So that means the diagnosis is done. Diagnosis is done. And you remember, I told you one thing very clearly. We have got one element called D. No? The fourth D, the first one, discharge condition.
Discharge date.
Date of writing, and the D4 is diagnosed. Okay, this is D3. Remember, in the Pradoc area, we have got 4D. One is discharge date. Sorry, discharge
Condition.
yeah, discharge date, and date of writing this letter. Date of writing this letter. Usually, these two things are always the same. In most cases, date of writing and discharge date will be almost the same. But I'm talking about the D3, sorry, D4 positive or D4 negative. What is D4 positive? Diagnosed. And what is D4 negative? Not diagnosed. So if it is a D4 positive letter, then you are writing the letter to usually whom? To a
non-case
nurse. A nurse.
And if it is a D4 negative, you are writing to a doctor.
A doctor.
Did you understand? I think many people didn't understand this beautiful thing. Did you understand or not?
I don't understand.
I will explain. Listen, because it's very important. This is one of our recent inventions. This is one of our most recent inventions, and somebody is speaking in the class. Please be careful in the class. Okay, so what is D4 negative and D4 positive? Please listen to me carefully. Suppose you brought this patient, any patient, and you diagnose the patient. In 95% cases, you can provide treatment for the patient who is diagnosed by your own facility, right? Am I right or wrong? If a patient is brought and if you diagnose the patient, okay, if you diagnose the patient, what will you do after diagnosing?
As a nurse, you have to refer.
Treatment.
Diagnosis after that treatment.
Yeah, definitely. See, once the diagnosis is done, the next stage is treatment. You start the treatment. Okay. After the treatment, if the treatment includes any kind of surgery, something, then there will be post-operative care. Time will be there. After the post-operative care, you will discharge the patient. And if the complications are increasing and the surgery doesn't become a success, definitely what is the next step? You will transfer. Yes, you will transfer the patient to the next place. That's it. Okay. At the same time, suppose you got the patient diagnosed, you provided treatment, the treatment was successful, and then you transfer the patient to another one. You will simply discharge. See, understand this. There is a correlation everywhere. There is a beautiful correlation. Okay. D4 positive means diagnosed. If you diagnose a patient, you will definitely provide treatment. And if it is a success, then you will discharge. If it is a failure, you will transfer to another facility. But if it is a D4 positive, but as per the diagnosis, as per the diagnosis, the patient is having some serious cancer, and your hospital does not have a oncology department. You don't have a cancer department, cancer treatment. What will you do? Will you do treatment or will you transfer?
Transfer.
Yes. Then the connection between you and the patient is disconnected. You don't have to worry about that because it is transferred. But at the same time, it is a D4 negative or not diagnosed case. I think everybody can see the screen, right? You can see?
Yes, sir.
Thank God there is no internet problem is not there today. Thank God. Okay. At any time this can happen. Usually it happens. Okay. Now listen. If it is a D4 negative or not diagnosed case, see, suppose a patient is coming to your hospital and you tried all the ways, X-ray and everything, CT, everything, but you couldn't diagnose the patient. So will you start treatment or not?
No.
So what will you do? What will you do?
Transfer.
Yeah,
You
you have to transfer.
Referral.
You have to refer. That means
further treatment.
Fine. So that means it becomes a kind of a transfer. You are transferring the patient from your facility to a doctor. Okay, that is equal to referral only. Okay. So now that's the reason I told you. If the patient is not diagnosed or if it is D4 negative, the letters are usually written to doctors, because what is the point of writing or transferring a patient to a nurse if the patient's disease is not diagnosed? So this is very important. D4, positive, negative. If D4 is positive or diagnosed, then we usually write this to nurses usually, or physiotherapist usually, sometimes psychiatrist or psychologist, sometimes to okay,
Dietitian.
yeah, sometimes dietitians. Okay, so but if it is a D4 positive case, D4 positive means after that you will start treatment. Okay, and then sorry, once again, did I make a mistake? Okay, D4 positive means you will be writing the letter to the nurses. I think I made a mistake somewhere. If it is a D4 negative, that means when it is not diagnosed, you write this letter to doctors. That's it. I think that's very clear to all of you, right? So we went back to this, and we have just 5 minutes left for Ms. Yashwada's class. So let's go to the next area. The last one for today. Pain was okay. This one is totally irrelevant in this case because we don't have to include this. Okay, 1 second. Anybody having any question to me?
Yes, sir. In this case, you have told me that complaints of pain in abdomen we can write now, sir. Sir, already we have mentioned diagnosis in the above paragraph, in the purpose paragraph, and then we can write it the patient presented to the hospital or admitted to the hospital with the aforementioned diagnosis.
No, there's a problem. We are not allowed to write the word aforementioned and above mentioned. This is a very serious issue. So the best thing is, I will show you the first paragraph for this one. Here, there is a first paragraph. We may remember yesterday we wrote the first paragraph this way. Can you see here?
Yes, sir.
Home visit to provide advice on self-monitoring of this. Okay, she has a scheduled appendectomy. In that case, we did not mention about the abdomen pain. The abdominal pain will be mentioned here in the second one. Here, Mrs. Ramamurthy was admitted on this month. So there are mistakes in this one. We will be correcting this with the diagnosis of acute appendicitis. Okay, with the diagnosis of acute appendicitis, which was okay. This letter is not corrected. Okay, so it's not good to discuss this letter. So after completing this, we will start with the correction of that letter because that letter is containing some issues. So I cannot show you that now. Pain was sudden in onset, so we are going to remove this area because it will make the letter so lengthy and you will be losing a lot of mark for including, because here Alfonso Matthew is the recipient and she is going to provide a visit and for giving instructions, and it's all about diabetes, nothing about appendicitis. So we have to exclude all the things. So well planned case notes, well written case notes to confuse anybody. So that is it. So as I told you yesterday, to pass OET, you need only 3 things. 1, English language. Second one, medical knowledge. Third one, this one, common sense.
Common sense.
Okay. So please, some of you may think that I'm saying that you have no common sense. No, please don't think that way. But we don't usually use the common sense. That is the only thing we want to say. Okay. So that's the end of this class. So we will be continuing this class at 3 p.m. and the next class is at 10 a.m. Ms. Yashoda is getting ready for you. And 11:30 we will be having reading and listening. So please get ready for that. Any question, please, regarding this? If you have any questions, or if you want to take a screenshot of this, you can take a screenshot of this one now if you want. If you want a screenshot, you can take it and leave the class. Bye. See you.
Thank you, sir.
Thank you, sir.
All right. Please take the screenshot. Yeah, okay. Bye-bye. So take the screenshot, please. And take the screenshot of this one also if you want. Okay. So we will continue this one at 3 p.m. So please join the class. It is very important. Nobody will be missing the class because it's very important. See you then. Bye.